It's your second baby. You are an absolute pro, but you still might be making mistakes. So let's talk about what mistakes you might be making and how you can easily fix them, because I know you are a busy mom and you don't have a ton of time to devote to getting prepared for birth. This time, let's go. Now, I hope you realize, because you've already had a baby, that when you're talking about birth, you definitely want to look for an expert. In case we haven't met yet, hello, I'm Hilary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I am here to easily prepare you for your upcoming hospital birth. Now, before we get started, you might be making the first mistake that you don't need a birth plan, but I still think it's really important to think about what you'd like for this birth, even though you're a seasoned pro. And as a note, this video is actually for anybody who's already had a baby. So even if it's like your second or your 70th, although I hope it's not your 70th baby, let's dive into it. Okay, the first mistake is sort of acting like it'll be as easy as your last pregnancy. And I gotta tell you, every subsequent pregnancy was a little bit harder for this girl. I got older. I think my body just got more tired. I swear the second time around, my body was like, seriously, it was so hard to heal last time. Why are we doing this again? So when you're like, oh, I just feel so much worse, I get you. I see you. It's not unusual to feel worse on each subsequent pregnancy due to age and just your body's getting tired and you can't rest like you could on that first baby. And let me just remind you, it's not just your family that's growing. We're actually really trying to grow this Pregnancy Nurse YouTube channel. So if you can give this video a like, it really helps, and hit subscribe because I'd love to hang out with you for the rest of your pregnancy. Now, here's a phrase I like. Well, I don't like it, but expectations are disappointments in advance. And luckily, you've already had a baby, so you've probably gotten through the idea that postpartum doesn't look like those beautiful pictures that we all see of people with their newborn babies. But you're going to think that you should act just the same way as you do on your first. I know a lot of people are saying, I don't dream about this baby like I did on my first one. I don't think about how amazing it's going to be to have a baby like I did on my first one. And that is normal. Honestly, your first one, you might not want to hear this, sort of a practice kid. I mean, you get lots of time with them. So you make up for all the mistakes that you might make by being with them more frequently. But this baby, you're going to have more experience. You're going to be a better parent the second time around. So that's the good news there. It's just going to look a little bit different. Now, beyond a baby, there's a good chance you're also hauling around a little bit of birth trauma in this uterus. Who knows what it's from? It might be how difficult it was to heal, how hard it was to breastfeed, how your provider didn't feel like they supported you. Who knows what the birth trauma is, but it is likely you're hauling around a little bit of birth trauma on this next pregnancy. Now, if that birth trauma is affecting you a lot, I would 100% recommend going to therapy. I had airplane trauma because I had an uncle who died in a plane crash. And so I literally went to therapy specifically to be a better plane rider because I wanted to be able to travel with my family and not freak out inside. So if it's affecting you a lot, I totally recommend some therapy. If it's not affecting you too much, I would still recommend something that we're going to talk about in a little bit in this video. Now, quick, tell me down below, what number pregnancy are you on? Let's see who's had the most babies that's watching these videos. Okay, I just want you to remember that you have other kids. Like, there are so many needs on you at this point in time, and you need to be kind to yourself at that point. I remember on my third baby, my kids wanted to go to the pool so bad. We didn't have a pool at our house. We had to go to a friend's house, and I could barely keep my eyes open, but I was like, I'm going to soldier through and take these kids to the pool because they deserve to have that in their mom. And I totally ran into somebody trying to get out of my driveway because I was literally so tired. I just didn't have the faculties of like how to check appropriately for a backup. I'm just telling you that you got to be kind to yourself. And there are going to be things that you have to skip, modify, change because you are pregnant. And that is okay. And your kids are going to deal with that. It would have been so much better if I just said, guys, I'm too tired and flipped on the TV for them versus trying to drive in a time when I was just like not ready. I shouldn't have been driving. Now, a lot of you are going to think, I'll probably go into labor earlier than my last one. And I'm here to tell you that that doesn't seem to be the case when you look at the studies. It doesn't show that second-time moms tend to have their babies too much earlier, maybe a day earlier than they had on their last babies. So if you're thinking, gosh, I'm going to go early, I'm here to say you should still plan on going late, even though you've already had a baby. And the final thing is a lot of you are going to think, oh, I've already done this. I don't need to take a birth class. I do not need to get prepared. But I am here to tell you that you are bringing that trauma and expectations from your last birth, or just things you somehow cobblestone together that was true about birth, which may or may not be true. So many people think I don't need a birth class because I've already had a baby. And I'm here to tell you that it's a good idea to still get a birth class. That is in fact why I have the basic version of the online prenatal class for couples. It is perfect. Chef's kiss for the second baby, because it's just there to quickly take you through third trimester testing all the way through postpartum to help you remember and understand all of it and make good choices for yourself as you look towards your upcoming delivery. The other good news, you can do it at home. So unlike the hospital, you don't need to find a babysitter and sit in a hard chair for 3 hours on a Tuesday night. Instead, you can do it from your couch, even while your kids play in front of you. I still recommend getting that partner involved, but I know it is even trickier on your second plus baby. Now, these aren't the only mistakes that you can be making. I have a whole video on the third trimester mistakes that you might be making, and I would 100% make sure that you're watching that video too.